Well, as you see, two blood flows are simultaneously passing through the heart. The right atrium receives the venous blood from the upper and lower parts of the body, while the superior and inferior vena cava, respectively. The right ventricle pushes this blood to the pulmonary circulation via the pulmonary trunk. The left atrium receives the well-oxygenated blood from the lungs. The left ventricle squeezes this blood to the aorta. Thus, we have two circles of circulation, the pulmonary and the systemic one. But it's not always this way. Such circulation pattern establishes only after birth. We do not breathe during our intrauterine life, so just systemic circulation is open in fetuses, while the pulmonary vessels are closed. The fetal prenatal circulation differs from normal postnatal circulation, mainly because the lungs are not in use. Instead, the fetus obtains oxygen and nutrients from the mother through the placenta and the umbilical cord. The advent of breathing and the severance of the umbilical cord prompt various neuroendocrine changes that shortly transform fetal circulation into postnatal circulation. Blood from the placenta is carried to the fetus by the umbilical vein. Less than a third of this enters the fetal ductus venosus and is carried to the inferior vena cava, while the rest enters the liver proper from the inferior border of the liver. The branch of the umbilical vein that supplies the right lobe of the liver first joins with the portal vein. The blood then moves to the right atrium of the heart. In the fetus, there is an opening between the right and left atrium, the foramen ovale we talked about, and most of the blood flows through this hole directly into the left atrium from the right one, bypassing the pulmonary circulation. The continuation of this blood flow is into the left ventricle, and from there it is pumped through the aorta into the body. Some of the blood moves from the aorta to the internal iliac arteries to the umbilical arteries and re-enter the placenta, where carbon dioxide and other waste products from the fetus are taken up and enter the maternal circulation. Some of the blood entering the right atrium does not pass directly to the left atrium through the foramen ovale, but it enters the right ventricle and is pumped into the pulmonary artery. In the fetus, there is a special connection between the pulmonary artery and the aorta, called the ductus arteriosus. This ductus directs most of the blood away from the lungs, which are not being used for respiration at this point, as the fetus is suspended in amniotic fluid. At birth, when the infant breathes for the first time, there is a decrease in the resistance in the pulmonary vasculature. As a result, a higher proportion of the output from the right ventricle flows into the lungs, compared to the ductus arteriosus. Consequently, the pressure in the left atrium increases relative to the pressure in the right atrium. This leads to the closure of the foramen ovale. Additionally, the increase in the concentration of oxygen in the blood leads to a decrease in prostaglandins, causing closure of the ductus arteriosus. These closures prevent blood from bypassing pulmonary circulation and therefore allow the neonate's blood to become oxygenated in the newly operational lungs. Sometimes these postnatal closures are incomplete or absent. So, what remnants of fetal circulation do we have as adults? The aperture between the right and left atria, which become the fossa ovalis. The ductus arteriosum obliterates into the ligamentum arteriosum. The left umbilical vein becomes the round ligament of the liver, and the intrahepatic part, the ductus venosus, obliterates into the ligamentum venosum. And the umbilical arteries, they become the medial umbilical ligaments. And you understand, those do not always disappear. If these vessels remain patterned, that will lead to the development of pathological conditions such as patent foramen ovale in the heart, or patent ductus arteriosum in the great vessels, or even patent ductus venosum. All of them above require surgical corrections.